In this video, we'll discuss East Hill's expansion into primary care. East Hill Medical Center is now known as a key primary care office here in Keuchee County, but it wasn't always so. Over the first 2 decades that it operated as a family planning center, staff saw the growing need for general healthcare services in addition to reproductive health. In response, it expanded its services to include an internal medical office in fall 1992. First open to just existing patients, it later opens its doors to the community in January 1994. The primary care office allowed for the community residents to seek healthcare and preventive care in the Fulton Street office, accepting those with and without health insurance. The tagline was, "For the healthcare you deserve." The organization spent the year before opening to the public, creating the infrastructure to be able to expand those services, as well as recruit additional clinical staff. Private funds and grants were available to support this expansion into primary care, as there was a national conversation happening about people not being able to access medical care. Locally, the decision to expand into primary care came from looking at community needs. An article in The Citizen from late 1992 reported that many residents didn't have access to primary care, in part due to a lack of providers accepting Medicaid. It also reported that these residents sought care at the hospital, which, to quote the article, bears the brunt of the burden of caring for sick people, especially the poor, who have no regular doctor. Indeed, among their own clients, East Hill saw a growing number of women who didn't have primary care, but were not eligible for Medicaid, so they simply skipped healthcare visits. Upon opening, it initially only served its 3,000 current reproductive health patients, with the bulk of those patients being women 18 to 35. Those first services were for minor illnesses such as sore throat and respiratory infections. Opening these services to the community would require a building expansion, at least additional clinical spaces. This was a major factor that contributed to the purchase of the Metcalf building downtown a few years later. In the meantime, small-scale renovations took place in 1993 to add 2 more exam rooms to the Fulton Street space. That space was up and running by January 1994, billed as General Medicine Primary Healthcare Services. 27 years later, our adult medicine office is still fully functional, now located on the 4th floor of our Metcalf building.